computer.
Got it.
Hi, I'm Rhonda Massad from the West Island News, and I am here with Dr. Dick Menzies. He's a respirologist at the MUHC. Thanks for coming on.
Hi, good afternoon, Rhonda. Sure, it's a pleasure.
Okay, we are talking Bill 96 today. English groups in Montreal say they plan to protest Quebec's Bill 96, which aims to strengthen the province's French language law. The demonstration is slated for May 14th, starting at Dawson College in downtown Montreal at 10:30 a.m. this Saturday and ending in front of the Premier Legault's office on McGill College Avenue. Moving right on into it, let's get you back to saving lives. The education portion, turning into Louisiana is commonly deployed as the boogeyman in Quebec to imply that without restrictive measures on the use of other languages, French is endangered. For most Quebec residents, there is a broad consensus that French should be protected, but many believe that the multilingualism, including indigenous languages, need not threaten French. How do you see the impact of Bill 96 on Indigenous people who have been primarily educated in English?
Right. I think that Indigenous peoples in Quebec will have probably less difficulty when they're in their own communities where services are already organized and provided, and often they're under their direct control, both in Nunavik, so northern Quebec, and in the Cree territory. They have really pretty good administrative control of their health services. But as soon as they leave those areas for either more specialized care or they're traveling or whatever around, so they go to they come down to Montreal or they go to Chibougamau, whatever, then there they may be having difficulties accessing services in English. I think the other group that we shouldn't forget about are the foreign-born and immigrants who come to Quebec. Not every immigrant is able to learn French. Sometimes it's the grandmother who comes to join the family, and then they need care. And certainly my experience, has been to try to offer translation services so that people understand, what's wrong with them. So we understand them. So we understand we can take a proper history, very crucial in their care. And of course, we can explain to them what the diagnosis is, what treatment is needed, and that sort of thing. I mean, you can imagine trying to explain to someone a diagnosis of cancer is not easy in any language.
It's terrifying in any language. I'm just wondering if Bill 96 is in my opinion, my opinion is irrelevant, but is the timing off? Like, has the CAC really read the room of people that are coming out of 2 years of isolation? Has the CAC misread the room that they're in? And it's just, I am wondering if it's the right time for this.
So I find it difficult to comment on timing, but for sure, I've been in practice for quite a few years. Perhaps you can tell from my gray hair. And my sort of interest clinically is in tuberculosis. So I see, frankly, a lot of foreign-born and Indigenous populations as part of that practice. And, my experience has been for the last 30 years, a lot of people are newly arrived or recently arrived, where they're coming from communities, Indigenous populations, where they've not learned French. And when they're sick, it's not the time to insist on language. It's the time to provide humane, compassionate care, to communicate with them the best that you can. And if that involves either in English or getting a translator so that you can communicate to someone who's from Vietnam or China, I think that's, as a physician, that's what I feel I should do.
Do you feel that the Bill 96 should exempt the healthcare system?
Absolutely. Okay. Absolutely. I don't see that when you're sick, it's the time to insist that you should be, able to understand and converse and so on in French or in any particular language. I think, of course, if we have the capacity to find a translator to speak to them in whatever language they speak, we should do that. That is simply what I consider good care. Good, high quality medical care includes, optimal communication. It's clearly part of care. And I think it's not humane to insist on, language restrictions when it comes to taking care of people's medical problems.
I think medically speaking, when you're heading into the hospital, one, you're afraid, two, you're likely in pain or not feeling your best. And you've got, in the case of our seniors, we've already got a tax system. People are waiting in emergencies for 24 or 36 hours to get seen. I don't know that we need to involve yet more people, more delays. It's going to take extra time. There's no question. If you're speaking to somebody who's not understanding you, you're double timing. The physicians have yet more burden. The nurses and préposés will have more work to do, and they just don't seem to need that right now.
No, and again, think of some poor patient who's got, let's say, chest pain. Chest pain is not, we need to understand what is that in order to help them. And then if we find a diagnosis, imagine cancer. You're trying to explain someone a cancer diagnosis and treatment and the options, and it's very complex. You want to be able to communicate with them to the best of your ability, and being able to access translators, being able to speak to them in whatever language, that's good care. That's simply being humane. That's simply being compassionate. I don't think as a society, we want to give that up.
And when you leave the hospital, generally you have medications. So that is another component. How is the person? Oftentimes, I know with my senior parents, we've got to manage several different medications and the counterindications. How does somebody go out into the world with French only documentation?
Right. So I think, again, patient education materials that explain a medication, that explain a treatment, absolutely invaluable. In our clinic, we have a TB clinic at the hospital. We've accumulated over the years pamphlets and documents in probably 30 or 40 different languages. A lot of them actually from the US, from CDC, from Centers for Disease Control, that have produced these documents on all kinds of TB related topics. And they're very useful to give to people to help them understand what's going on, to help them overcome their fears, the stigma, and of course, to take medications properly for a cure.
Right. Okay, I just want to read something to you. In the healthcare system, systemic discrimination against Indigenous people has been formally recognized. In 2019, the Quebec-mandated Viens Commission concluded that it is clear that the prejudice towards Indigenous peoples remains widespread in the interaction between caregivers and patients, and recommended at that time cultural safeguard principles to incorporate into the healthcare services and programs for Indigenous people. Bill 96 will create greater impediments to accessible healthcare for Inuit and First Nation people, amongst others. This belief is that the bill will worsen and the healthcare system instead of improving it. And I assume you're in accordance with that.
I think there's certainly a big risk that, communication is key, and already there's clearly distrust based upon, the past experiences that many Indigenous peoples have had in our healthcare system. So being able to welcome someone and communicate to them clearly in a language they understand well, obviously that goes a long way to making them feel safe, to making them feel trusting. And trust is the basis of a healthcare relationship. If my patients don't trust me, they're not gonna listen to me. They're not gonna follow my recommendations.
And even if they do, there's a mental health component to it.
Oh, of course.
That feeling comes from your mind as well.
Well, of course, trust, confidence, the feeling of well-being. Part of being a healthcare professional is indeed comforting people, making them feel better. And I don't know how to do that if I can't communicate with them. I
think that kind of says it all. This weekend's rally at Dawson promises to have quite a few participants. Will you be attending?
I'm not sure, I'm afraid. Okay.
When we are not just going to have the student body there will also be many other groups. Do you think that this rally will have an impact? Do you think anybody at the government levels are going to be listening to this?
Again, I don't have any insight into what the government listens to. I would hope that they listen to, I know that the College Médical du Québec, so our professional corporation of physicians, has concerns. The professional societies have concerns about this impact on care. I would hope that the health minister listens carefully to the concerns about the impact of something that is coming from the Ministry of Justice and is being imposed on the health system. I would hope the health minister looks at his responsibility to safeguard the health care of all Quebecers and says, no, this should not apply to healthcare.
Okay. Okay. I want to thank you very much. That was Dr. Dick Menzies from the MUHC, he's a respirologist. Thanks for coming on today.
Thank you, Rhonda. Thanks for the opportunity.
Okay,
Great.
so we want to wish everybody a great upcoming weekend. May 14th is the rally at Dawson. You can check all that out on the West Island News Facebook page. We've got that event listed there for you to get all the information and get on down there if that is your jam this weekend. So we want to thank you again, Dr. Dick Menzies. Have a great rest of your day.
Thanks, Rhonda. Bye-bye.
Bye now.